Well, good morning. I'm King County Executive Dow Conference Room. I'm the head of the state's largest local public health agency, and on behalf of Public Health Seattle and King County, I'd like to welcome the governor and other state leaders who are here today ready to take action on this emerging problem of vaping and health. We've made amazing progress toward reducing traditional tobacco use here in King County. Keeping kids from initiating cigarette use is an incredibly important step to assuring a healthy future. But vaping is putting this progress at risk. This powerful nicotine punch is putting a new generation of youth at risk for nicotine addiction. We've had 2 confirmed cases of vaping illness here in King County. And I'm concerned that this may be just the tip of the iceberg. So the potential for an exponential increase in severe lung illness is very real. Youth vaping is at epidemic levels in King County. We need to take immediate steps to protect our communities from harm. State law restricts local leaders from acting, so I am able only to law leaders and to take legal action against vaping companies responsible. King County is ready to do both. Earlier this week, I directed our attorneys to pursue legal action, and today I'm very grateful to be joined by leaders of our state who share the urgency and are ready to act both now and in the next legislative session. Thank you, Governor Inslee, for your leadership today. Washington State needs bold action, and we need it now. Governor Inslee.
Thank you, Dow, for your leadership on this and so many things in public health. You've been a real public health leader your whole career, so thanks for your great leadership. We know this in Washington State and across the United States. Today we are experiencing a very serious health crisis. It demands the governments to protect the public health of Washingtonians, particularly our young people. Severe lung disease, and this is severe lung disease, has been reported all over the country. We have already had 7 serious cases in the state of Washington from vaping devices or e-cigarette products. This is an issue both about a dangerous product from a toxicological standpoint that is a serious health crisis and a problem with lifetime nicotine addiction that an industry is trying to hook our children on for life. So these issues are in addition to at least 12 deaths nationwide, and there have been over 100 lung injury severe cases across the United States from these related products. It does not have to be this way. We need to act for the public health of our people. We've got to do better to regulate, to monitor, and to communicate to the public the dangers of these products. Now, experts have not yet identified the specific chemical that is specifically causing the physiological reaction that have caused this problem. But we know that there is a action causing this problem, and that is the predatory marketing by this industry to our children, intentionally trying to addict them to various products and using flavoring to do so. These kids get hooked, and they get hooked for life. So many products in this industry are targeting children. They are flavoring products with flavors attractive to our children: bubblegum, raspberry, cinnamon, and the like. These flavors exist for one reason, and one reason only, and that is to make them more appealing to young children. These products are also packaged in a way to appeal to young children. Now, we do not have evidence at the moment that the flavoring chemistry itself is the reason for the disease, but it is the reason for the disease because it is hooking our children on the product in the first place. Now, Big Tobacco is required to stop marketing to children by federal action and litigation from using cartoon characters and targeted advertising to youth. Young people have been told that smoking could kill them due to warning labels that have been federally required. But for young people and for adults, vaping has been, in some sense, wrongfully seen as some safer alternative. It turns out that might be true given to the health crisis that we now are experiencing. And it is certainly not true from the sense that it is addicting our children for one of the most powerful addictive substances in the world today, and that's nicotine. So we know that vaping at times have been used by people to help a cessation effort off of tobacco and some of the particular matter in tobacco. So we understand that. But we need to understand it's important to note that those products have limited warning labels, letting people know about the dangers. Now, Washington State's legalized use of cannabis for adults is a well-regulated system, and that is not going to change. However, vapor products are often mixed with other things, and the Federal Food and Drug Administration does not know and review the contents of these liquids. Anything could be included in the mix. It is the Wild West, and that is one reason we're having this health crisis. So we are not waiting for the big tobacco industry to tell us what is in their products. We won't trust them with our health. We won't trust them with our children's health. Their interest is in making money. Our interest is in protecting the health of our children. We are interested in ensuring that adults and young people have known and regulated ingredients in these products and have information about them. Everyone deserves to know what is in these vaping liquids when they are inhaled into our lungs. So right now, this is an unregulated industry that could include anything, and we have no way of what it is. This is a giant hole in the ability to protect the public health of our citizens. So vaping products and e-cigarettes must be regulated and not marketed to our children. So today, I'm announcing an executive order to help make our state safer from these products. So my executive order will direct the Washington State Department of Health to take several actions. It will ask the State Board of Health to adopt emergency rules to ban all flavored vapor products, including flavored THC products. I expect the board to take up this request and vote on it at their next meeting on October 9th. My executive order also directs the department and the Washington State Liquor and Cannabis Board to do the following. First, immediately ban any ingredients or sources that are found to be the cause of this acute lung illness. Next, I expect to work together to draft governor request legislation for the next session of the legislature that would ban permanently all flavored products, that would require disclosure of all ingredients in flavored products, to increase the regulatory oversight of these products, to limit bulk sales, to expand our educational campaign, and to clarify that the Department of Health's authority has, in situations like this, where there is harm or risk to the public, but the specific cause, from a chemistry standpoint, has not been yet identified. It also requires these agencies to immediately take whatever steps they can to warn consumers of the risks and to encourage healthcare providers to report all suspected cases and expand their educational campaign to increase awareness around the dangers of vaping. Now, this is particularly important. I think consumers in this country have unfortunately been lulled into this sense that if you buy something, that there's some regulatory body that will protect you from dangerous chemicals in this product. That doesn't exist today, either in the United States or the state of Washington. And we have to up our expectation of performance to protect the health of consumers. I do want to make something clear. I wanted to do more by this executive order. I wanted to go further than this, but I have followed our existing statutory authority. We aren't done in this discussion. What I'm doing by this executive order is a floor, not a ceiling. It sets up a further dialogue so we can continue to look at the science on this issue as science continues to come in. So this is part of an ongoing process regarding protection of citizens from vaping and smoking. Early this year, I was proud to sign a bill that raises the legal smoking level to 21 years of age. This has long been a priority of mine and Trudy's and many other people across the state, some of whom are joining today. That was the right thing to do to stop our kids from one path to nicotine addiction. Now we are adopting measures on another. So that was good and necessary, but it was not enough. I am confident this executive order will save lives. I am confident it will save children from a lifetime of nicotine addiction. I am confident it will reduce this epidemic of youthful vaping that today is driving parents and grandparents crazy across the state of Washington. Just as I was pulling in here, I was on the phone with a fellow who works at Amazon who told me that his son had started vaping just out of nowhere, and this was like taking off like wildfire through his school. It's time for the state of Washington to protect these kids, and that's what we're doing. So I want to thank everybody involved in this. I'm now going to turn it over to Attorney General Bob Ferguson, who has been a tremendous leader on the age 21 issue, and I'm looking forward to his help in any way. Thanks, Bob.
Thanks, Governor. Thank you first, Governor, so much for your leadership on this issue and the action you're taking today. I also appreciate the Governor saying, hey, this is the floor, not the ceiling. He's laying out a roadmap for future actions that need to be taken, including going back to the state legislature to ban these flavors permanently, an effort we undertook a number of years ago. Secretary Weissman, the Governor's office, and many folks here, that was blocked by the Republican-controlled Senate back in 2015, 2016. One thing I just want to add, I'll be very brief, is the Governor mentioned the bill passed last year to raise the age to purchase tobacco and vaping products from 18 to 21. That was a bill we proposed years ago. We've all worked together, everybody here on that. One thing I just want to emphasize is I think one key reason why that bill finally crossed the finish line last year was the greater awareness of the role of vaping, family members, communities, educators. And I just recall clearly in very moving testimony that we had before the House and the Senate, students who said things like, hey, when I turned 18, I got text messages from my friends saying, hey, you're 18, can you now buy me some vaping products? We also heard from educators, administrators in schools who talk about the challenges they have of kids blowing into the restrooms and vaping away and having to put in literally sensors in the restrooms to monitor that. The impacts on the schools. This is truly an epidemic. That is not too strong a word to use. So appreciate the Governor's leadership and that of everybody here, and look forward to working with the Governor again as we go back to the legislature to, as he said, take the next steps as we go forward. Next to speak is someone who's been a great partner. I so appreciate his partnership and his leadership for all the people of the state on health issues. John Weissman. John.
Thank you. Good morning. Vaping, like smoking, is not safe. It never has been, and it never will be. Nicotine and marijuana are addictive substances and can harm the developing brain of our youth and young adults. The risk of vaping for everyone, youth or adult, are even more obvious right now in the midst of this outbreak of vaping-related lung injury. As the Governor said, we now have 7 cases in Washington state. Local, state, and federal public health workers are actively investigating all potential cases reported to us. And we're looking at emergency room data to actively identify any potentially unreported cases. It is critically important that all healthcare providers immediately report any suspected cases to their local health department so public health workers can quickly interview the patient, review their medical records, talk with their healthcare providers, obtain biological samples for testing of infectious diseases and toxic chemicals, and retrieve vaping products for laboratory testing. All of this is critical and necessary to identify the specific product or products causing this lung injury. From 2016 to 2018, vaping in our 10th graders rose from 13% to 21%. And it's even scarier for our 12th graders, going from 20 to 30%. We've been concerned about vaping and the dramatic rise in our youth for some time, as you've heard, and have taken action, as the Governor and Attorney General mentioned. I look forward to working with the State Board of Health to implement emergency rules to ban all flavored vape products, including mint and menthol, and to work with the legislature to make that ban permanent. We simply must do everything we can to stop more children and young adults from starting vaping and exposing them to these dangers. This executive order gives us clear direction. Finally, the current outbreak of vaping-associated lung injury is another reason to quit vaping today. To help quit nicotine, call 1-800-QUIT-NOW or find online resources at the department's website at doh.wa.gov/quit. For teens, we have an app called Tomorrow, which is also available on our website. And to help quit marijuana or other substances, call 1-866-789-1511 or go online to warecoveryhelpline.org. If you choose to keep using vaping devices, which I really hope you don't, it is very important that you monitor yourself. Watch for a cough, shortness of breath, or chest pain, and promptly seek medical attention if you have any concerns about your health. Let your provider know if you've been using vape products. Do not use any products from unregulated sources or bought off the street. And do not alter your vaping devices or add any substances to them. These lung injuries are extremely concerning, and we all need to act. Our hearts go out to those family and friends who have lost someone to this lung disease. I appreciate Governor Inslee's leadership on this issue. I also appreciate all of our healthcare providers and public health staff who are working so hard to track down the problem and provide care to patients. Now it's my pleasure to introduce to you Director Rick Garza from the Liquor and Cannabis Board.
Thanks, John. Thank you, John. Governor Inslee, thanks for your leadership on this issue. Also want to thank Secretary Weissman for his help in working with the Liquor and Cannabis Board. So working together under the direction of the Governor, the Liquor and Cannabis Board has been working closely with health officials the last couple weeks. At our request, leaders in the cannabis industry sat down with the LCB staff to learn more about how vapor products are processed, where additives are sourced, as well as ways we can work collaboratively to address the issue at hand. In addition, we've also convened conversations with other states that have legal cannabis, we refer to as the Regulators Roundtable, to share information and strategies to deal with the issue before us. There has been a lot of misinformation that we've been trying to combat, such as focusing on suspected ingredients or that the illnesses only pertain to products that have been tampered with. With a single cause not identified, we know illnesses have arisen from vape products that contain THC only and nicotine only. These cases stem from cases in both regulated states and unregulated cannabis marketplaces. Together with the Department of Health, we're developing a co-branded warning sign that will issue that requires posting in all licensed cannabis retail stores warning consumers. In general, the cannabis industry has been supportive of our planning and has been helping along the way. In our meetings, it became apparent that vaping additives come from many different sources. Although products are tested, they're only tested for those elements required by the Liquor and Cannabis Board and the Department of Health: potency, moisture, pesticides, heavy metals. We will immediately notify cannabis licensees that we will be requiring that all licensed processors provide and disclose all ingredients of vape products. We will compile this information until the sources of the illness are found. We have this with this information at hand. Should we have a single cause that's identified, we can then prepare recall for product in our cannabis retail marketplace. We are also strengthening our recall procedures today. We'll be working with Governor Inslee and our state and the industry stakeholders to do whatever is necessary to protect public health.
Good morning, everyone. I'm Senator Patty Cooter from the 48th Legislative District. I'd like to thank Governor Inslee and all in attendance up here for their work and attention to this serious health crisis that's happening here in Washington State and across the country. For generations, teenagers have been the key market for the tobacco industry because they have known and exploited the medical science that now tells us that if you don't start smoking until you're 21, the odds of you ever picking up that habit dramatically decrease. And I'm proud to say that thanks to decades-long national public health efforts, we have dramatically reduced tobacco consumption among teens and adults. It's a life-saving effort that culminated here in Washington with legislation to raise the age to purchase vapor and tobacco products to 21. And that will go into effect on January 1st of 2020. Prevention is indeed the key, and we're still making headway. We will be working with Governor Inslee and his office to draft legislation to ban flavors, and Senator Karen Kaiser is working on legislation to make labeling requirements more strict. However, the rise of vaping has threatened this hard-earned progress. To reduce nicotine addiction and the same tactics that attracted young people long ago, the tried and true brands like Marlboro and Camel and Kool, utilizing gimmicks and favorable depictions in media to attract young people to their products. And that's what flavors are. And I've heard heartfelt stories from adults who are trying to quit smoking and that vaping has helped them. I've also had teens in my office concerned about their peers who are addicted to nicotine, some as young as 6th grade. The truth is, gummy bear flavor, raspberry flavor, mango flavor, there's no mango in mango flavoring. And these flavors are designed to target young people, to hook an entire new generation of people on nicotine. Information is our most important tool in the fight today, and the governor's executive order moves us closer to stop the cycle of addiction before it begins. And now I'd like to introduce Representative Jerry Paulette.
Thank you, Senator. I'm Representative Jerry Paulette from the 46th District. As a parent and as a faculty member at the UW School of Public Health, in 2015, working with Governor Inslee and the Attorney General Bob Ferguson, I introduced legislation at their request, and because of my years of concern and research on the epidemic of vaping, that would have given us the tools to prevent these deaths and illnesses in Washington State in 2015. I want to thank the Governor and the Attorney General for being bold and upfront years ahead of the curve, recognizing in their request legislation that, one, we needed to know what the ingredients were, and two, give the Secretary of Health and LCCB clear authority to ban substances that research shows have a substantial threat to public health and maybe the cause of injury. Substances like diacetyl, which are a primary ingredient in flavoring, known for causing popcorn lung disease, in professional terms, bronchiolitis obliterans. It is as nasty as it sounds, obliterating lung tissue. And it is prevalent in the flavorings, along with two other chemicals that are chemically and physiologically similar in terms of their impact, and they are present in many of the major brands that our children and youth and teens and young adults are becoming addicted to. Make no mistake about it, this industry has chosen to use flavoring to addict a whole new generation to nicotine, and the research is overwhelming that 3 to 7 times a child or a teenager is 3 to 7 times more likely to start smoking if they initiate vaping. And as the Board of Health's just adopted really tremendous health impact review, which I recommend to you, shows flavors are the key gateway to vaping for our youth. I will be returning with Senator Kuderer, working with the Governor and AG to reintroduce legislation to ban flavors. We will be working on making sure that we label and disclose ingredients. And furthermore, this crisis has shown us that we need to be able to provide emergency authority to the Secretary of Health. And we also need to make sure that we provide tax revenue from this industry for the enforcement and public health efforts which you have heard described in detail here already, about the importance of being able to have public health workers out there, which we are horribly underfunded. I'm sure Executive Constantine will be glad to speak to how underfunded our public health agencies are at the local level. So I look forward to working with the Governor and Attorney General and my colleagues on responding to this crisis and providing them the tools to protect our youth from a new wave of addiction. Thank you.
Good morning. I'm Dr. Jeff Duchin, the Health Officer for Public Health Saddle and King County. I have just a few brief points. Although there is much we don't know about the health effects of e-cigarette use and vaping, what we do know is not good. We're in the midst of a large outbreak of serious lung injury linked to vaping and e-cigarette use. In addition, the long-term health effects of these products remains completely unknown. We do know that nicotine is highly addictive. It interferes with brain development, concentration, memory, and impulse control. And adolescent exposure to nicotine can predispose to use of other addictive substances. For these reasons, it's been clear from the get-go that youth, young adults, and pregnant women should never use e-cigarettes or vaping devices. And the actions described here today make great sense from the public health perspective in order to protect the health of both youth and adults in Washington State. And I'd like to thank the Governor, Governor Inslee, and Executive Constantine, and all our colleagues at the state who are going to be implementing the actions that you've heard described. Thank you.
Okay, I'm going to sign this and then we'll take some questions here. I'm signing this executive order because we believe we need more protection for the public health of our citizens. We know that our most precious citizens are young people, and it is time to prevent corporations meaningfully and intentionally trying to addict them to nicotine. And I look forward to working with everyone in the state as we continue to try to reduce this epidemic and this health crisis. Okay, we are happy to stand for your questions.
So, Governor, this is immediate, correct, this emergency ban? Does it need a vote from the health department right now?
It does need a vote by the Board of Health under our statutory framework, and they will be meeting October 9th, I believe. We believe it's entirely appropriate for them to act, and I'm requesting them to do so. Then we would move forward with statutory changes, presumably, in the legislature following. But as soon as the board acts, it would become an immediate prohibition.
How are flavorings
Flavorings
defined in this executive order?
John, you want to talk about that? Yeah.
We need to write the executive order for flavorings, but we'll look to what we did for tobacco, where we removed flavorings in tobacco. So we've got great law to look at, and that's what we'll be doing between now and October 9th.
Do you think naturally derived terpenes from cannabis will be considered a flavoring?
I don't have the answer to that right now.
If this
Go ahead.
Do you first off, can you say how long this? I mean, presumably this is a temporary action by the health department. If they approve this, how long would that last? And then can you say what specifically it is about state law that has limited the ability of the state to respond to this? Did you consider doing, or you said you considered doing more. Can you say specifically what that was? Massachusetts is temporarily banning the sale of
So I believe the board has to make this a permanent rule, should they decide to do so. I do think it's important both to have statutory action to make that a permanent law of the state of Washington so it doesn't depend on who happens to be on the Board of Health, and I will encourage the legislators actually to do that. Our law has some ambiguity about our ability to prohibit certain products without a necessary tie to a particular chemical. Rather than to test that in the courts, we thought this was the thing to do today, that we can do today to prevent this gateway addiction of our young people, and that is the immediate emergency we had to respond to. Again, I do hope people will listen to John and the doctor about the risk associated with the vaping products. there is such great uncertainty about vaping products right now, and we need to warn the public that no federal government or state government or local government has tested these products to give you any assurance that they're safe. And I'll just tell you, if I had a loved one, I would tell them right now, you are just playing dice with your lungs if you're using these products, because there's such uncertainty given the very serious lung situation that we've had.
How do you explain the United Kingdom?
What's that? I'm sorry, I'm recognizing this public. Excuse me. We're going to take questions from the media.
95% safer,
Yeah.
and the government supports
That's
it.
great. What media
Questions from media outlets
outlet?
only.
Great. Well, we can talk.
So
We're taking questions from the media.
Considering this is the United Kingdom's public.
Excuse me, sir.
Questions
If
from
you
media
don't want media
outlets
outlets, then
only.
we'll expect you to leave
And
right now.
they actually sell it in hospitals.
Excuse me, sir. I'd like to stand for your question. Thank you very much. Listen, let me be clear here. This is a contentious issue.
Yeah, because you don't believe
It's
the
your-
facts.
Questions from media outlets only.
This is a
All
right, I'm going to expect you to be quiet for a few minutes because I'm going to speak. This is a very contentious issue. People involve this in their personal lives. We understand that this is a controversial issue. We understand that some people believe this has helped them in their tobacco cessation efforts. We understand that. We've listened to people in this regard. But we believe that the public health of the state of Washington demands that we protect our children from these addictive programs. So I'm going to stand for questions from the media, and I believe you are with the media.
Yeah, I'm with the Seattle Times.
Yeah.
So, I've heard everybody said this is an epidemic.
Mm-hmm.
If it is an epidemic and other states have gone further, why not ban all vaping products, as soon as the health board can do so?
Well, without going to the actual substantive merits of that, we believe there was ambiguity about the ability for the state to act on an executive basis without further legislative activity. We decided it would be better to engage the larger public in that discussion, including the legislature, to make those decisions. We think given the nature of this challenge to young people, it was appropriate to take this action for flavoring, as that is such a gateway to this permanent addiction. But we thought, given the nature of this, and embracing the legislative approach to that is the better way to have the statewide dialogue.
Do you think people are playing dice with vaporizers that your government has regulated and approved under the LCD's regulations?
Well, we have not had sufficient authority to regulate those products, at least in my view, nor have we had enough scientific information. And the source of this scientific information, to some degree, by necessity, needs to come from the federal government, because that is the government that really has the ability to do the physiological and chemical tests on these products that have been added to this. This is one of the reasons we are very hopeful that the federal government will step up to the plate and do the research necessary on a as quick a possible basis to get those answers. The state of Washington, frankly, does not have the capacity to do the epidemiological studies that you would need on that kind of particular question. Next question.
How long will this emergency rule last? So this is temporary basis, correct, unless it's approved?
It would essentially be up to the Board of Health. Now, my executive action will be good as long as I'm governor. I hope people that is extended. But my executive action will be while I'm governor.
Governor?
Yes.
This is a question for Rick Garza. Rick, what is the LCB doing to look into what regulatory authority you might have about cutting agents, like vitamin E oil?
Well, I think the number one thing, and there was a question that was asked previously, is that the act that the board's going to take to require disclosure of all compounds, additives, solvents that are used in creating the product, that's not something that we've been testing for today. Without knowing exactly what the culprit is, the chemical itself, and we assume it's not necessarily cannabis-based with respect to the cannabis injuries, it's something that's being added. Vaping's been around for quite some time. What's happening today in the last year that's creating the problem? We believe it's an additive. We believe it's an ingredient. So the disclosure by the cannabis industry, the processors of these products who disclose all chemicals, will help us once the CDC or the Department of Health determines what the problem is so that we can address it, we can move it out of the marketplace.
Are you going to ask the illegal drug dealers to send you a list of these
Excuse me a
that they're
second.
putting in their routines?
You got a question over here, sir? Yes.
Are you going to do
Yes.
that?
I have a question right here. You have a question, sir, back
Quiet
there?
down so we can do our job. Thank you.
Yeah.
Well, you guys don't ask the right questions. You don't ask.
Please
the
stop.
questions.
Okay, you're going
Thank
to need
you.
to leave, sir.
Yeah.
Yeah, go ahead.
You can
Governor,
drag
there's
me
a
out of
couple of
here.
Go
big
ahead.
shop owners here from Puyallup and many others like them who say if you ban flavors, you're going to put them out of business. I believe it's roughly 4,000 stores in the state. What do you say to that?
I would say that we are acting for the public health of the citizens of the state of Washington.
What about
The
cigarettes?
state of Washington has an obligation to protect public health.
What about cigarettes?
We are particularly attentive and caring about the young people of the state of Washington.
What about
And
cigarettes?
we believe we put the
480,000 deaths a year with
health of our children as the pinnacle of our obligation. And that's what we're doing here today, and I think that's the right thing for the state of Washington. Look, when you addict a 12-year-old kid to nicotine, you're just wrong.
Cigarettes.
There is no excuse in this state to addict a 12-year-old child to nicotine. And
You
we're going to
guys
stop
are
that today.
absolutely doing a disservice to
Who's the next
those
question?
voters who stop.
Who's the next question? Do you have one more question?
I have another question for Director Garza.
Yeah. Oh, by the way, can I wanted to amend the answer I gave earlier. So the emergency order by Board of Health, it lasts 120 days, but it can be renewed again, and I would anticipate that it would be.
So you've been talking with your licensees about this. What have you been hearing and learning about what is being added in these vaping products and where they're being sourced? And also, what are you hearing from them about their concerns about,
I'll be
about
outside
their business
waiting.
under this?
Well, I think I want to share it, and I want to thank the industry for coming together to work with us to learn more about it. There's a lot of things they don't know about the additives because they're not being tested. And so again, this is the first step that the governor talked about. We've got to learn more about and gather information about the additives and the source of those additives in these products. But the first way to do that is to require the disclosure of all chemicals so that we know.
And how concerned are they about their businesses? Have they expressed?
Well, of course they're concerned about their businesses.
Just to clarify, you're saying right now a cannabis product does not need to have all ingredients labeled on its label?
It does. But what we want to do is be able to have them disclose those chemicals to us directly so that we can now put that data together, keep it, and be ready. Again, what we're doing is hoping that the CDC or the Department of Health here could tell us what the chemical is that's causing the problem. So as soon as we find out, we can begin to recall and move it out of the marketplace.
So,
Any else? Any immediate questions? Yes.
real quick, I'm dealing with Cairo 7. So, what about the nicotine cartridges? So, the Liquor and Cannabis Board doesn't have oversight over the ingredients on that. And I know right now there are no ingredients listed on those cartridges, right? So, how does this impact that?
So the governor's executive order is asking the Department of Health to essentially put together a plan that would be able to gather the various information. We do not have that legal authority to do that. So put together a plan for that and work with the legislature to assure that we can get the same information.
Mr. Weissman?
Yes.
Just when the Board of Health votes on this on October 9th, does it go into effect immediately?
It'll go into effect the next day.
The next day.
Yep.
Is there any chance that this is not going to be approved?
We'll have a discussion with the board, and I anticipate that their concerns will be what you heard today, but we will have a discussion as a board.
Let me address that if I may. Look, we understand a contentious issue on this matter, but we have been through these battles and we have won them. When the big tobacco industries were trying to addict our children with Joe Camel and other measures, it was contentious, but we won that battle to save our children from this nicotine addiction, intentionally by corporate officers. And that was wrong. We've now moved forward to prevent the addiction of our children regarding the age limit that we passed this year. And I believe we will be successful this year, not allowing corporations to say, we're sorry, we have to addict your children because we got a business model that requires us to do so. It should not be anyone's business model in the state of Washington to addict our children to nicotine. And that's basically what we're talking about here. And so I believe we will succeed on this. Thank you very much. Appreciate it. Other people. But these people, I'm sure, will be available at a later date. Thank you very much.
Yeah, right.